ASH 2015 coverage continues from Orlando, Florida. I'm Thomas Baldrick, joined now by Dr. Charles Herbaux from Lille, France. Thank you, sir, for spending some time with us.
My pleasure.
All right, so you're talking before we started here about how French you are and how American I am. So give me the name of the hospital again.
I work to Hôpital Claude Urier.
Oh, I got no shot. Okay, so let's talk about this study you have with Nivolumab. What was the rationale for doing this combination study?
So the main question of this study is the safety of Nivolumab after allogeneic stem cell transplantation. Because this treatment is a checkpoint inhibitor and theoretically could activate some graft versus host disease. And it is very interesting to know if it's in practical this risk is real or not.
So how did you design this study to find out?
This is a retrospective study in classical Hodgkin lymphoma, and we treat patients with Nivolumab after allogeneic stem cell transplant if they relapse or if they are refractory to allogeneic stem cell transplant. So this is very, very heavily treated patients.
And what did the evidence show you?
We show that efficacy of Nivolumab is the same before and in our study after allogeneic stem cell transplant. And the main result of this study is that we see no GVHD, graft versus host disease, triggered by Nivolumab if patients have no history of acute GVHD. So this is relatively safe, we think, to treat these patients after allogeneic SCT if the patient have no history of GVHD or history of chronic GVHD.
How much did you learn from this?
I think this study is really interesting because the checkpoint inhibitors should be used in many other hematologic malignancies, and a lot of people fear to use the checkpoint inhibitors after allogeneic stem cell transplant, but many of the patients should become a candidate for such a treatment. So I think the study is very, very interesting in the future for the treatment of checkpoint inhibitor after allogeneic stem cell transplant.
So how will you proceed in the future with this?
This is a retrospective study, so this is just, I think we have to build some prospective studies, and Hodgkin lymphoma is a really good disease to assess in this case, because you know that this treatment is really effective in this malignancy, but all hematologic malignancies should be included in prospective future after allogeneic stem cell transplantation, because patients have real clinical need if they relapse or if they are refractory after such a treatment, allo-SCT.
Okay, thank you, Dr. Herbaux. Appreciate your time, appreciate your research.
Thanks to you.